Welcome, everyone. My name is Maria Margaglione. I'm the Programs Director here at the Depression and Bipolar Support Alliance. Today, we're going to talk about the importance of mental health screening for children. As many know, the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry have identified pediatric providers as critical to expanding access to mental health screening and care. With us today is DBSA board member, Dr. Nicole Brown. Dr. Nicole Brown is a general pediatrician and health services researcher and is the founder and chief health officer of Strong Children Wellness. Her research and professional interests center on enhancing care and service coordination for children who have experienced trauma and those with chronic mental health needs in the pediatric primary care setting. Hello, Dr. Brown. It is nice to have you with us today.
Hello. Thank you so much, Maria, for having me.
Yeah. So let's just jump in. Talking about youth mental health here, what trends are you seeing in your practice?
Sure. So in general, about 20% of children who present to care with a pediatrician have a mental health disorder. And pediatricians most commonly see internalizing disorders, so disorders like depression and anxiety, and externalizing disorders, the most common being ADHD. And in my practice, what we've been seeing, particularly since the onset of the COVID pandemic 2 years ago, has been really a surge, a dramatic increase in the number of kids presenting with mental health disorder. And so we're seeing about 30% of the children who come to care presenting with one of the three disorders that I mentioned most commonly. So that is depression, anxiety, and ADHD.
Those are hard numbers to swallow.
Yeah.
Well, and so knowing that pediatricians may be the first to identify mental health symptoms, how do you approach this in your clinic?
So the first thing we typically do, I'll speak in general for most pediatricians and then talk about my clinic more specifically because we're a unique practice in many ways. But most pediatricians start with screening for a mental health condition, and they can utilize a number of different screening tools depending on that child's age. And we tend to screen early and often in pediatrics, really with the goal of not missing a potential mental health diagnosis. And so, those screening tools can range from something called the PSC-17 or the psychosocial, it's a general psychosocial checklist that asks about anxiety, depression, inattention, or they can be more specific screens for depression. And we'll use, for example, a common one is the PHQ-9, or anxiety, we'll use a specific screener for that. So it really starts with screening. And I think one of the things that's important is that many pediatricians embed screening in a general well-child visit, with the goal being not only to identify sort of an emerging concern, but also to drive home the point that mental health is just as important as one's physical health. And we integrated physical checkup because the two hand in hand. And, I in my practice, we really drive that point home to parents and to the youth that we see, because mental health, unfortunately, is still very stigmatized. And so we'll screen if we identify a concern, depending on how severe it is. If it's a mild concern, we often will closely follow it and bring that child back in a few weeks, maybe a month or two, to see whether or not it's about the same. Has it gotten better? Has it gotten worse? If it's more severe, moderate to severe, then we'll often refer out to our behavioral health colleagues. And if I could just expand a little bit on my practice. So we're a bit unique at Strong Children Wellness in that we actually embed primary care into community-based mental health and social service agencies, with this idea that, for many families, social determinants of health and mental health problems are just as important, and for some families even more important than the physical health concern that they might have. And the real experts at addressing mental health and social need are in these community-based social service agencies that have been doing this work, in our case, for many, many decades. And so what we do is we not only screen at every well visit, we screen for mental health conditions at sick visits, pretty much anytime a child comes in, because again, we don't want to miss a concern. And we recognize that in many of the families that we see, who many live in poverty, that what you may not pick up in one visit, it may change in just a few weeks later or a month or two later. So we screen pretty often. And then when we identify a need, we refer to our community partners.
Well, and another good thing about screening early and often is you're building rapport. So if someone is new, the more you meet with them, the more you keep driving in that this is important to me, as I treat you. Yes. And the importance of physical and mental health, they are tied. They are not in vacuums. So that kind of education is so important. Out of curiosity, how are parents, how are they responding to these?
So most parents are actually grateful that the question is being asked. For many parents, again, particularly since the onset of COVID, behavioral health, emotional health is a concern, and they sometimes don't know how to bring it up to their child's pediatrician. And so, they'll sort of suffer in silence, if you will. And the same with kids. And so when the questions are being asked unprompted through screening, you really sort of see almost like them relax a bit and a little bit of a sigh of relief that someone's asked. And then, the screener opens up a much broader, deeper conversation about what's going on. So for the most part, many parents really want to talk about these issues, particularly if they're severe enough to need help. And so that's why it's just so important that we ask the question without even the parents even coming to us with those questions.
Mm-hmm. What would you say? So I'm hoping that kind of information will be helpful to pediatricians watching this. We know that not everyone gets in-depth mental health training. Pediatricians don't. And when you're early in your career, there's a lot to learn anyway. Do you have any advice for even in training, whether they be students or newly in practice? Do you have any advice for them?
Yeah, so that's a great question. I think because we're seeing such a surge in kids presenting with these conditions, it's really, really important to educate and make yourself aware about, number one, the various screening tools that exist. So I sort of spoke briefly about 3, but there are a number of them that can be used and tailored to sort of your practice and your workflow, that are evidence-based, that have been tested in different populations, but that ultimately have the same goal: to pick up a potential mental health condition. And so really familiarizing yourself with the more common screens that we use that screen for ADHD, anxiety, depression, is sort of the first step. I think for trainees, particularly for students, try to administer a screen to a patient. Oftentimes in a busy practice, someone at the front desk or a nurse or even the doctor or provider may hand the parent the screen, and they'll fill it out themselves, and then you sort of have to score it and do it. But I think for trainees, it's important to try to ask the parents the questions to get a flavor and a sense of, how apprehensive that may be, how apprehensive they may be, how to sort of work with that apprehension. So familiarizing yourself with screening is important, and the different screening tools. I think second is knowing when to refer. So, this is not just, it's both an art and a science. And, parents and kids will often, there are parents who are like, I want help now and I want to see a therapist. Can you make that referral? And others, again, in part, it may be due to stigma. In part, it may just be due to, I just kind of want to watch and wait. We're going through some changes in our household. They may change for the better. Let me come back in a month or two and let's see how things are. Really learning how to sort of gauge where families are, where the child is, where the parent is, and meet them where they are before jumping to a referral is really important. And then I would say the third thing is collaboration. So not just making a referral and say, okay, I did my part, I checked my box, I identified a mental health concern, I referred you to a therapist or a psychiatrist or both, I did my part. Really, really getting the parents' consent to talk to who the therapist is that you referred to, or the psychiatrist, or both. And then working as a team together to ensure that, whatever management plan is devised, that everybody's on the same page, that you sort of know what's going on. Oftentimes the therapist, because they're seeing a patient weekly, gets a much deeper picture of the family of that child than a pediatrician can. Even though we see kids throughout a good chunk of their childhood and early adulthood, we're not seeing them as often. So we may not know when issues arise, when family dynamics change, and really developing a collaborative relationship with that child's behavioral health team allows for that. So that's really important.
Well, and so, I guess the, mental health concerns can present differently in children than adults. So being able to have that conversation, often with children, it could be a stomach ache. So both providers knowing that kind of information would be so helpful for each other to know.
Absolutely. I'm so glad you said that, actually, because in children, behavioral health disorders, issues present in really subtle ways sometimes, particularly in younger children. So you mentioned one common symptom that we see. Frequent stomach aches, are often could potentially be a harbinger of anxiety disorder. And so really, again, for trainees and for people learning kind of the art and the science of pediatrics, really understanding those subtleties comes when you're intentional about screening, about collaborating, to your point, with the therapeutic team, and about sort of meeting families where they are and constantly checking in to see how things are going. Are they worsening? Are they getting better? You get a good sense of those subtle presenting symptoms that often come present in pediatric practice.
Do you know where they can get these screening tools or learn more specifically about them?
Yeah, so the American Academy of Pediatrics a few years ago put together a really great mental health resource toolkit that's freely available. It can be found on their website, aap.org. And there's lots of good stuff in the toolkit, but there is a link to a really comprehensive document that lists all of the evidence-based mental health screening tools used in primary care pediatrics. It sort of categorizes them by age. Most of them are brief and are designed to be delivered, administered in, an office visit. So folks can go to that website to learn more.
That's great. We'll put that resource wherever we land this interview, whatever page this lands on, and in the communications that are being sent out to pediatricians. And for that, we're very excited to be reaching pediatricians, especially with our Mood Crew resources. Can you talk about how you or how others can use these resources in their office?
Sure. So, I think every office is different and has their own unique workflow. So, some of what I'm going to share, tailor it to your unique experience. But, in general, these screening tools are helpful to administer before the doctor gets in the room to see the patient, in part because, if, for example, a parent walks in our practice, what will typically happen is that the nurse will give them the tool as she's doing what we call triage. So she's checking vital signs, weight, height, those kinds of things. And then afterwards, she'll hand the parent the tool in the privacy of the exam room. If it's an older adolescent, we'll often have the parent step out and have the adolescent do the screening tool confidentially. And it may add just a few minutes to the overall visit time, but it's well worth it for the reasons we talked about. And then that screening tool will come across the pediatrician's desk before they call the patient in to be seen. I use that time to briefly look it over and quickly score it to determine whether or not there's an emerging issue or there is a definite concern. And then I call the patient in and I'll proceed with the visit. And, every pediatrician sort of has their own style. My visits are very open-ended, and so I'll often ask what the parent or the child's primary concern is. And sometimes they don't immediately bring up the behavioral health concern, but I know based on how the questions were answered that there is a concern. Sometimes they will, and that may be the primary concern. And so, then you have this data from the screener to be able to help guide the discussion. And, again, these screening tools aren't diagnostic. They're not meant to diagnose a condition, but they're meant to identify potential concern and at least open up a conversation that gets deeper and allows you to sort of determine next steps with the family. So I think, in general, that's how the workflow typically is in many practices. The screening usually takes place in the very beginning before the doctor sees the patient so that the provider has the data needed to make an informed decision with the family.
Well, this is, as always, it's always so good to talk to you and listen to everything you say. There's so much heart and passion and wisdom. Is there anything else you want to share with pediatricians who are going to either see or hear this?
I would just say, DBSA is an amazing organization, and I'm a little biased. Obviously, I'm a board member, but they have some fantastic tools for young adults and for children. One is a collection of really fun characters called the Mood Crew that is designed for younger children who may not have the language to articulate what they're feeling. Or, you may be seeing behavior as a parent that's concerning, and your child just can't really tell you why they're behaving that way. The Mood Crew has characters that represent some of the big feelings that kids have. And these characters come to life in a variety of different activities that parents can do at home with their kids. And if there's time that you can start to introduce in the office during the visit. So you'll be able to learn more about the Mood Crew by visiting DBSA's website. But what I'm most excited about when it comes to the resources that DBSA provides, particularly the Mood Crew, is giving parents a tool to actually take home with them, work on together with their child. And, it's one thing to give sort of verbal advice during a visit, but when you actually give parents homework and children homework and activities that they can do at home to reinforce some of the things you spoke about, I think it really drives certain lessons home. And so I just wanted to put in a plug and share my excitement about the Mood Crew as a tool that can be incorporated in the workflow of a busy practice.
Well, we really appreciate that. And for all the pediatricians on this mailing, we're going to have all these resources available for download. Some of you who got the actual physical packet will see even more colorful, real physical pieces of material for you to share with your patients. So, well, that's great. Thank you so much again. And for pediatricians, if you go to dbsalliance.org/pediatricians, we will have all this information for you and a link to the resources that Dr. Brown mentioned as well. So thank you very much.
Thank you so much for having me, Maria.